Good afternoon, everyone. Welcome to Nashville General Hospital's Wellness Wednesday Facebook Live program. Thank you for joining us today. I'm Kathy Poole.
And I'm Kaylin Harris. Our goal of Wellness Wednesday is to introduce you to Nashville General Hospital experts, have them share information vital to your health and wellness, and give you the opportunity to ask questions during their presentation. Joining us today is Dr. Abu Ali, Medical Director of Nashville General Hospital's Internal Medicine Hospitalist Program.
The Hospitalist program at Nashville General Hospital is in partnership with TeamHealth. Dr. Abu Ali is a medical, clinical, and executive leader certified by the American Board of Internal Medicine. He is a graduate of the University of Jordan College of Medicine and completed his residency at Texas Tech University Health Sciences Center and a fellowship in infectious diseases at the University of New Mexico. In addition to his role as medical director of our hospital medicine division, Dr. Abu Ali is also an adjunct assistant professor for internal medicine at Meharry Medical College. Everyone, please welcome Dr. Abu Ali.
Hello, everyone. Thank you very much. Thank you, Kathy, and thank you, Kaylin. I'd like to take this opportunity to shed some light on what a hospitalist is and what that concept means. I know it's relatively new concept to the medical practice over the last probably 15, 20 years. So I'll spend the coming 5 to 10 minutes, if that's okay, to just give a brief idea on what a hospitalist is, what does a hospitalist do, and answer any questions afterwards. I'd like to share a few slides that would help everyone track what I'm going through. And I'll start with the definition of what's a hospitalist. The simple definition is hospitalists are experienced medical doctors who are trained and board certified with focus on coordinated medical care and well-being of patients in the hospital. The main focus of the hospitalist is the patient while they're in the hospital. And of course, we work in coordination with patients' primary doctors, other specialties, and I'll get into that into more depth in a second. Usually, the hospitalist holds a primary specialty, and usually it's internal medicine or family medicine. On occasions as well, the hospitalist can carry subspecialty training and provides 24/7 inpatient care to individuals who are hospitalized. Of course, throughout the hospital stay, the hospital manages and coordinates day-to-day issues. That includes diagnosis, treatment, and taking care of the patient from the minute they're admitted through the emergency room to working them up, sending some labs, sending some workup, getting the results, interpreting these results until the patient leaves the hospital. So anyway, he's the patient's partner throughout the process from the minute they get to the hospital to the minute they leave. Of course, during the hospital stay, the patients might need to have other subspecialists involved in their care, such as cardiologists, surgeons, nurses, hospital services like dietary or physical therapy. Hospitals are the key members in this process, and they meet with all these providers. We analyze the data, we coordinate the plan, and help the patient get better and recover. Because of our experience and being familiar with the hospital's resources, we can do this efficiently using the expertise and tools available to us. So in addition to taking care of the patient, we work with every department. We know the resources, we know how they can help our patients. Ultimately, the goal is to use all these resources and put them together to help the patient and get them better. Of course, the hospital stay can be worrisome and can be stressful. And part of our jobs is to help the patients understand what's going on. And the ultimate goal is to eliminate any confusion and guide the patient to the best possible care and outcome. Having multiple services involved in the patient's care, different physicians involved in patient care can be a little intimidating at points. The hospitalist is the centerpiece, working with the patient, having the feedback and the input from all these services, all these specialists, and present them in a simple, friendly, and easy way to the patient to understand what they're going through and what their plan is and what the expectations are in terms of their health and recovery. Of course, a good number of our patients have caring and concerned family members sharing these or this trip with them. And when family members are involved in the care, the hospitalist will include them in the conversation so everyone understands what's happening and intended in the course of action. Of course, that happens with the patient's permission to make sure they're comfortable with sharing information. And of course, the patients are ultimately the directors of their care. So they get to choose who gets the information, who not to get the information, and how far to get their family members involved if they give us the green light for that. In addition to coordinating the care while the patient is in the hospital, the hospitalist also shares information with the patient's primary care provider. As mentioned, our role focuses on the patient's care while in the hospital, but to get that accomplished, we coordinate with the patient's doctors who take care of them on a regular basis before they come to the hospital. And even after they leave the hospital, we communicate with their primary doctors with updates on what happened during the hospital, what modifications we did, and what changes on their medications happened. In addition to that, long-term care or additional recommendations that we would suggest to make sure they continue to improve and that we're all on the same page and work as one team, whether we're in the hospital, outside the hospital, to accomplish our goal. Of course, the hospitalist will also connect patient to resources that can help with their recovery and ongoing treatment. That includes resources that are in the hospital, including physical therapy, home care, prescriptions, and at Nashville General, we have a very strong case management department. They are very well informed and they're very familiar with the resources we have in the hospital and in the community. And they successfully utilize all these resources to help the patients, whether it's helping with paying for their medications, whether it's ranging for outpatient physical therapy in the hospital, or even linking the patients with other community resources that can provide either a shelter for them, food, and of course, Kathy can elaborate and give us more information in future sessions about the other services that the hospital provides, that the case management provide, and how we continue to help our patients beyond taking care of their medical illnesses. Why do we do that? Why are hospitalists taking care of the patients in the hospital? Why not their primary doctors take care of them? Multiple studies already has showed that this type of coordinated care from the hospitalist team can lead to shorter length of stay and lower cost per stay, which are good things for the patients and the hospital at the same time to provide the best care possible. The hospitalists at Nashville General Hospital give patients personalized attention during this hospitalization. And as mentioned, by doing this, we make sure that every patient gets the best care they can, tailored for their needs. And we utilize all the services that we have, also tailored for every patient, using the help of our case management department, dietary department, and all the other departments that continue to help us get our work done. Care from the hospitalist team is tightly coordinated with the goal that our patients get the best possible medical attention. And as mentioned, I'll say this again, we all work as a team. We take care of the patients in the hospital. We coordinate with the primary care before they get to the hospital. We update the primary care, and we use any resources we have to help them out. Any questions or any point that you would like me to give more details, more information?
Well, thank you, Dr. Abu Ali, for sharing all of that wonderful information about what a hospitalist is, and what all that you all do in your role that make it such an integral part of the Nashville General Hospital system. And I'm still checking. So for anyone that is watching us virtually on Facebook Live, please ask any questions that you may have for Dr. Abu Ali in the comment section right now. I am monitoring the Facebook chat. Um, Give me one moment. Let me check and make sure we don't have any questions in so far. And then Dr. Ali, you can stop sharing your screen when you're ready.
Back to you.
So one of the things you had talked about, the coordination of care. So having hospitalists that are seeing the patients while they're an inpatient, and then being able to coordinate with our specialty clinics and our primary care clinics is really part of what makes Nashville General Hospital and its Nashville Healthcare Center a patient-centered medical home, because we want to make sure the patients are taken care of before going into the hospital and then afterwards. But does a patient have to have a PCP within the Nashville healthcare system, or community physicians? Do you do a lot of interaction with them?
Thank you very much, Kath. That's an excellent question. Actually, we see all types of patients. Patients who have primary physicians in the community and choose to have Nashville General as their place to get the inpatient care. And we have patients who do not have primary physician. One of the great things about Nashville General is our ability to connect our patients or patients without primary with our hospital clinics. And despite of their status, insurance status, situation, we're always able to help the patients and connect them and get them established within our system. This is one of the unique things about Nashville General Hospital compared to other hospitals in the area. We have the inpatient service. We have primary physicians who work with us as a team at Nashville General that we freely communicate with them, and we're able to establish care for our patients. And we have specialists that are within the same network. So we have everything under the same tent, I would say, which is unique compared to other hospitals where they focus mainly on certain specialties, certain clinics, outpatient or inpatient service. In our case, we take complete care of the patients from the moment they get to the hospital to the moment they leave, and following them up afterwards, and even establishing specialty services for them if they don't have them.
Thank you, Dr. Abu Ali. And I believe we have one question that just came in. Our viewers had great information. Did Dr. Ali mention the difference between a hospitalist and an attending physician for inpatient care, and how do they work together?
Yes. So in terms of definitions, a hospitalist is an attending physician. So it's just using different terms for the same provider. In certain cases, or previously, the traditional system, the primary doctor would admit their patients to the hospital, take care of them in the hospital, and still they will be called an attending physician. The hospitalist sole focus would be take care of the patients while in the hospital. So from the moment they get to the hospital, that's where the hospitalist takes over. After they leave the hospital, they go back to their primary physician, and mainly it's just the focus in the hospital. In terms of definitions, again, the hospitalist is an attending physician. He's a specialist as well, internist or family medicine specialist, and they can have more specialties as well. Just like myself, I have infectious disease training as well.
Thank you, Dr. Ali. And I do have a question, because a lot of times when we do our Facebook Live sessions, we have people from all different industries and walks of life, but we also have a lot of medical residents that tune in and view as well. So what advice would you give to any residents about patient interactions? Because much of your role is customer service based and interacting with patients and their families. So, I think a lot of time residents, they learn everything in their manuals and their books, but what's the biggest piece of advice you would give them about patient interaction?
I think there are two simple pieces of advice that I keep in mind and share with my residents all the time. Treat every patient as if he's a family member, and always make sure that every patient is part of their management plan. They help us manage their cases or diseases based on what they feel is best for them. At the same time, we provide the best evidence-based medicine that's available to help them get better.
Thank you.
Thank you.
Well, and since you are in the hospital so much and you work with so many different areas, whether it's case management or even lab or oncology, are there any areas where the information that you're able to get from the patients or even analytics, anything like that, that has helped driven patient care, whether it's an improvement, process improvement within the hospital?
Of course. All the working or collaboration with departments ultimately aims at improving the care of the patients, facilitating the care, and cutting the cost to the patients. Having hospitalists working in the hospital 24/7 helps us decrease the length of stay, and that's been proven over the years. And doing that, we are saving actually lots of money for the patient. They don't need to be in the hospital for 5 or 6 days when they can get the care provided in 2 to 3 days. And that's part of us being involved on daily basis rather than just rounding on the patient in the morning and maybe seeing them the next day. Being in the hospital 24/7, covered by the service, helps us move the plan real faster, getting all this in timely manner, decrease a readmission rate, I would say, by connecting them to our primary care clinics. We make sure they get follow-up, they get their medications refilled. That will decrease emergency room visits and readmissions. So in a way, using all these resources, working as a team, helps achieve better patient care, better service to the patient, and of course, improves patient satisfaction.
And Dr. Abu Ali, in my research and in my understanding, the hospitalist sector of the medical industry is fairly young, it's fairly new in comparison. So, but I know it's ever growing, ever changing, and the job for a lot of medical residents, the job market is booming with hospitalist positions. Where do you see your particular industry or your sector? How do you see it growing in the next couple of years, or how have you seen it change post-COVID?
Yes, I think there'll be even more transition towards the hospitalist service. Bigger hospitals, bigger healthcare systems are shifting towards having a dedicated physician or physician group taking care of their patients while in the hospital. There is more focus, and there has been more focus over the last years about patient satisfaction, about metrics, about decreasing hospital stay, about all these numbers that we use to reflect better patient care, to reflect patient satisfaction, to reflect doing what we're doing without compromise. So with that being a bigger focus over the last few years, I see the industry in general moving more towards the hospitalist care rather than the traditional care with the physicians, primary care physician admitting their patients and take care of the hospital. In a way, they cannot be 100% available for their inpatient patients, and at the same time be 100% available for their outpatient or primary care patients. So in a way, and for better patient care, I believe that the industry is moving towards more implementation and integration of hospitalist services.
And I am still monitoring our Facebook live chat for any questions that may come in. Give me one more moment.
So when we talk about family members and, they have a loved one in the hospital and, sometimes it's like, well, I can't get a hold of anybody, but that's, do they start with the charge nurse, or is there a way to get directly to the hospitalist, or should they go through the specialty provider or primary care provider since you're already interacting with them?
When the patient is in the hospital or under our hospitalist service, we take full ownership of our patients. We treat them like family. And for that, we don't need to actually wait for the family to call us. if a patient gives us permission or mention that they have a sister, a daughter, a father who would like to know what's happening in the hospital, we on daily basis call them, communicate with them directly, give them an update, see if they have any questions, any concerns. So anyway, we treat them like family. They have easy access to us. They can either call the floor directly. They can just talk to their loved one at the hospital and tell them, I would like to talk to the doctor, get an update. We personally call them, talk to them, address their concerns, and again, make sure they're part of the management and care for the patient, and they're comfortable with what's happening and they're aware, because the more they know, the more comfortable they are, and the easier it is for them and for the loved ones to get better and to be part of the plan.
Well, Dr. Abu Ali, that is all the time that we have today for this segment. But first and foremost, we would love to thank you for speaking with us today and just sharing all of your wonderful knowledge about your industry and your career path. We really appreciate you.
Thank you very much. Thank you, Kaylin. Thank you, Kat, for giving me the opportunity. And of course, if there are any questions or any issues that anyone would like to discuss about the hospitalist service, the services we provide, the care we provide, please feel free to reach out to me.
Yes. And see, I think you should join us. You should be our other co-host. I was about to say the same exact thing.
Thank you very much. It's a pleasure.
Yes, I was about to say the same exact thing. If you have any additional questions, please continue to comment below or feel free to message the Nashville General Hospital Facebook page, and we will definitely make sure we get those questions over to Dr. Abu Ali at a later date.
Thank you to everyone who joined us today. Have a great day.
Yes.
Bye.
Thank you.
And happy Nurses
Bye-bye.
Week, happy Hospital Week, everyone. Bye-bye.
Thank you.